Ever wondered what people mean when they say someone has a partial stroke? Do you want to know how to recognize a stroke and what you can do to assist? Then this video is for you. In this video, we're talking about the definition of stroke, types of stroke, factors that can predispose one to having stroke, symptoms, and how to identify someone having a stroke. My name is Dr. Ben Oko with Dr. Connect. In this YouTube channel, we share general health tips which you will find useful. If you are new to this channel, kindly subscribe and turn on the notification bell to get more videos. Kindly note that this video is strictly for educational purpose and does not replace a doctor's consultation. Stroke is an emergency which occurs when blood supply to a part of the brain gets interrupted. There are different types of stroke. We have the ischemic stroke, which occurs when the blood vessels get constricted and there's a reduction in flow of blood to that particular part of the brain. This causes a reduction in nutrients to that particular part of the brain. We also have the hemorrhagic stroke, which occurs when the blood vessels burst or leaks and there's a spread of blood in that particular part of the brain. Some of the risk factors for hemorrhagic stroke can include uncontrolled high blood pressure, trauma, or if there is a weakness in any part of the blood vessel. We also have the transient ischemic attack, also known as a mini stroke. This is temporary and the symptoms typically last from 5 minutes and they resolve completely within 24 hours. Here are some of the factors that can predispose you to having a stroke. This doesn't mean that when they are present, you will definitely have a stroke. It's just a risk factor, and some of these can include uncontrolled high blood pressure, pregnancy. During pregnancy, we have gestational hypertension, which can then cause stroke later on, high levels of cholesterol, physical inactivity, obesity, taking large amounts of alcohol, children with sickle cell anemia. This is why it is recommended for children with sickle cell anemia to undergo transcranial Doppler ultrasound scan. Here are some of the symptoms one might experience when having a stroke. You might have sudden and severe headache, sometimes associated with vomiting. You might feel numbness in a part of your face, your arm, or your leg. You might have difficulty or inability to walk. There might be difficulty in swallowing. You might have vision problem, clumsy speech. You might have face drooping, and so on. Have you heard of FAST? No, not the normal FAST. FAST is an acronym which you do when you see someone experiencing some of these symptoms I've earlier said. F stands for face. Tell the person to smile and then check if you see a face droop or a tilt in the smile. A stands for arm. Tell the patient to raise his or her arms up. If you notice a clumsiness or the arm falls immediately. S stands for speech. Give the person a simple sentence to say and then notice how these words are said. Is it different from how the person normally speaks or not? And T stands for time. Remember I said that stroke is an emergency. You need to immediately take the patient to an hospital for care. Do not wait till it becomes an emergency before speaking to a doctor. Remember, you have 30 days free trial on the Dr. Connect app and you can download from the Google Play Store or the App Store. Get started today. If you find this video useful, don't forget to like and share. If you are new to this channel, kindly subscribe and turn on your notification bell to get more health tips. See you next time. Bye.